Hello, welcome to Winnebago County Health Department's TV show, where we talk about public health concerns and relate them to your health. Today, I have a few staff here as guests, and we're going to go ahead and let them introduce themselves.
So my name is Jena McNiel, and I'm a public health nurse at the Winnebago County Health Department.
And I'm Amy Winninghoff, and I am also a public health nurse with the Winnebago County Health Department.
All right, so you're both public health nurses. What division is your role underneath?
We fall under the Communicable Disease Division.
And can you explain for myself and for the audience a little bit about what a communicable disease is?
A communicable disease is a disease that can be transmitted various ways, person to person, through the air when you breathe in a bacteria or virus, by touching a surface that's infected or an object, also through infected food or water, and also through like insect bites, like a tick bite or a mosquito bite.
So very different from chronic disease.
Yes.
And are there different types of communicable diseases or levels?
Yep. Communicable diseases are put into 3 categories, and that would be from the state of Wisconsin. They've put all reportable diseases into one of those categories. Category 1 diseases are the most impactful. It's kind of based on the severity of the disease and how much it impacts the public health. So those Category 1 diseases have to be reported to our health department within 24 hours, and we need to follow up immediately. Those would be things like tuberculosis, meningitis, measles. The Category 2 diseases are needed to be reported to the health department in 72 hours, and those are the majority of the things we see in public health. And those would be things like salmonella and E. coli, and the sexually transmitted diseases like chlamydia and gonorrhea.
Okay. And there was a third level?
Yep, there is a third level, and that one is reported directly to the state because it is something we don't follow up on initially, and those would be like HIV people.
So do you still get notified when there's a Category 3?
Yes, so for HIV, what happens is the reporting is done to the state, but then the state notifies us locally of the new case. So at that point, then we would do what we call partner services, which would be linking the patient to care, and then also doing an interview with the patient to see who could potentially have been exposed, and then trying to notify those individuals and get them tested.
Okay. So with communicable diseases, what does the health department do locally to prevent those?
Sure. So primarily we track or monitor diseases, and we ensure appropriate treatment, and then we also provide education.
All right. Breaking those down a little bit, what is tracking or monitoring? Can you put those into some examples for us?
Sure. So tracking or monitoring, especially in public health, is a lot of times referred to as surveillance. So people may have heard that term. Basically, we look at what is coming into our county in regards to certain infections. So are we seeing an increase over a certain period of time, a decrease? Surveillance is also done at the state level and also at the nationwide through the Center for Disease Control.
Okay, so when you get that information that's numbers, how do you take it from that group to individual?
Sure. So I guess the first thing is, so for example, during influenza season, the state really monitors the numbers that are coming in through the state, and then it gives us an idea of what kind of messaging we need to be putting out to our community. Are we seeing an increase in the state, and if so, it should be something we're focusing on. And then also, I guess more at an individual level, we would be doing interviews with anybody that's positive for one of these infections.
What type of things do you ask in an interview?
Sure. So for interviews, we really focus on a few main things. So one would be symptoms the patient's having, and when those symptoms are occurring. It gives us an idea of when they are infectious or contagious. The other is making sure that they've been treated appropriately so that, 1, they recover from the infection, and 2, they're not spreading it to other people. And then the other is providing education, and that's on how they can protect themselves, their loved ones, their family, and also how they can be protecting, the general public health as well.
So in that treatment stage, how are we involved there? How do we make sure that the right treatment happens?
Well, the state puts out treatment guidelines, and actually guidelines for all of the reportable communicable diseases that public health follows. So there are specific guidelines for treatment, testing, isolation, how to follow up, for contacting contacts, finding people out there who may have been exposed to that infectious individual.
So to put this in real terms, can you kind of give us an example of something?
Sure. So we had a pertussis outbreak last year amongst mostly high school and middle school age students. And pertussis is whooping cough, so it is spread through the air when people cough. So for a pertussis, there is strict guidelines about testing, treatment, and isolation of those individuals. We work with that infected individual to educate them, as well as find out if they know of anyone else who may have the same symptoms. We reach out, make sure that they're treated appropriately, that they're following the isolation guidelines so they don't go out in the community while they still are infectious. And part of our contact investigation would be like, have these people been out in school activities? Are they in a sporting event? Do they participate, in like a theater, church events, things where they may have traveled long distances or gone away on spring break together, things like that, just to help us get information about other people who could potentially be infected.
Wow, there's a lot of background information that you guys go through. So then when it comes to, obviously we want to prevent it, so that education on the forefront, but when we know something's out there, how do we get the word out? How do we tell the public?
So we, one-on-one, do a lot of education when we're doing disease investigation and working with providers as well as hospital infection preventionists with providing the correct guidelines and updated guidelines. We work with school nurses, other groups, as well as our social media.
Right.
Right.
So I remember when the pertussis outbreak was going on, we
Right.
were putting together mass emails and putting it up on our social media. We do have that information for you guys. Our website is www.winnebagopublichealth.org, and our social media is at Winnebago Health. So I think that's a really good place for the public to know that they can go and find information under the Communicable Disease tab. There's a link right there for provider resources, and it not just for providers to go, but for the layperson to have information and know those guidelines that they should be looking for.
Correct. Yep. We have a lot of information out there on specific diseases and how to stop the spread. We do, as you said, have that provider section so that a provider can go right in and get the specific information they're looking for, or just contact information to get to us, the correct people, to give them that information.
Right, and so I'm stressing that too, when they don't know where to go. You guys are the gurus, you know what's going on, and you've been tracking it, so you're probably the quickest answer right there.
Hopefully.
Yeah, and if we don't have the answer, at least we know where to get the answer.
Okay,
So,
good. So this time of year, what is it that we're thinking about, we're working on?
Yeah, so a few like national observances, I guess, related to communicable disease. So one would be March 24th was World End TB Day, which TB is tuberculosis. And then the other is April, which is coming up, is National STD Awareness.
Wow, so not something we typically think of as being close to home, but is that a concern for Winnebago County?
So I guess I'll let Amy maybe talk about TB, and I can talk about the STDs.
So TB is one of those diseases that's not particularly prevalent in Wisconsin, but it is on the rise nationwide. And we have had a few cases here in our county recently, and cases that are antibiotic resistant, making it much harder. And it is something that takes a lot of time and energy and resources as a public health department. So it's important to help educate to stop the spread of that
All right.
disease.